When we hear the term heart failure, our minds often jump to this really dramatic, sudden event. But that's not really how it works most of the time. It's usually the final chapter of a really long story, a process that's been quietly unfolding for decades. So let's get into that story, because honestly, understanding it is the absolute first step toward changing the ending.
And we have to take this seriously. I mean, look at this quote. It really puts things into perspective, doesn't it? A 5-year survival rate that's lower than many cancers we hear about all the time. This isn't some minor issue. It's a major league health condition that really deserves our full attention.
But here's the thing, and this is the good news. Our bodies are amazing. They often send out signals, little warning flares, long before things hit a crisis point. The key is just knowing what to listen for. So what are these signs? Let's break them down.
Okay, so first stop on our journey. Let's get a handle on the symptoms. These are the outward signs that the engine, your heart's pump, is starting to struggle. All right, the first and probably most common sign is getting short of breath. But what's really fascinating here is the why. It's not just that you're a bit out of shape. Think of it like a traffic jam on the highway. The heart can't pump blood forward fast enough, so it starts backing up, right into your lungs. That backup causes fluid to leak, and that, literally, makes it harder to breathe.
Next up is swelling, which doctors call edema. You might notice this as tight shoes or when you take off your socks and see these deep imprints on your ankles. It's the exact same traffic jam principle we just talked about. The heart's weak pump causes blood to back up in your veins, and the pressure pushes fluid out into your tissues. It's a classic sign that the whole system is under strain.
Ever feel just bone tired, like completely wiped out no matter how much you rest? Well, that deep fatigue has a very clear mechanical cause. When your heart can't pump enough oxygen-rich blood to go around, your body is smart. It goes into a kind of low-power mode. It starts rerouting blood away from your muscles to prioritize the absolute essentials, your brain and your heart. The result? You feel exhausted.
Now this one might surprise you. Feeling confused or like your memory isn't what it used to be? It's so easy to just write that off as getting older, right? But reduced blood flow to the brain, plus changes in your body chemistry, can directly mess with your thinking. The main takeaway here is, don't just dismiss these mental slips. They could be your heart trying to tell you something.
Okay, so we've looked at the warning signs on the outside. Now, let's pull back the curtain and see what's actually happening on the inside to cause all this trouble.
The main villain in this whole story has a big, fancy name, atherosclerosis. But don't let the word scare you. It's really just a simple process, the slow, steady buildup of gunk, fatty plaques inside your arteries. Just imagine the pipes in your house slowly getting clogged over time. It's the same idea.
And this image right here just says it all. On the left, you've got a healthy, wide-open artery. It's like a superhighway for your blood, clear sailing. But then look at the right. You can see how that plaque builds up, narrowing the lanes, causing backups. This restriction is what eventually starves the heart of the oxygen it desperately needs.
And if there's one thing to really let sink in, it's this. That clogged artery on the right didn't happen because of one bad meal or a stressful week. It's the end result of biological processes and lifestyle choices that have been playing out for a very long time.
So let's actually look at that timeline. Let's dig into the story of how this plaque builds up, because for most of us, it starts so much earlier than we'd ever guess.
Just take a look at the very beginning of this chart. The first stage, what's called a fatty streak, can start in our first and second decades of life. Yeah, you heard me right. As kids, as teenagers. These are the absolute earliest, most subtle signs that something is beginning.
So then what happens? As we move into our 20s, our 30s, and our 40s, those tiny little streaks don't just go away. They grow. They collect more gunk. They become more complex, more established. It's not so subtle anymore. It's becoming a real structural issue inside the artery.
And right here, this is the critical moment. The final stage is what's called a plaque rupture. The surface of one of these plaques can literally tear open. Your body, trying to be helpful, rushes in to form a blood clot to patch up the injury. But if that clot is big enough, it can completely block the artery. And that is a heart attack.
Now, knowing this is such a long, slow-motion process, wouldn't it be amazing if we could catch it early on? Well, spoiler alert, we can. And that's where modern technology comes in. The big challenge for years was that many traditional tests, the kind you might get for a routine physical, are kind of like a smoke alarm that only goes off after the house is already half engulfed in flames. They only spot the problem after it's already become pretty severe.
This slide is such a game changer. Just look at the timeline. A standard treadmill test? It might not pick up on the disease until way down the road, maybe in your 40s or later. But a CT coronary calcium scan, it can see the evidence of that plaque buildup much earlier. It gives you a chance to intervene long before you're anywhere near a crisis.
Okay, we've talked symptoms, we've talked causes, we've talked detection. Now let's get to the most important part of all. What can we actually do about it? How do we take control of this story?
To find the real solution, we have to go all the way back to square one. Before any of the plaque, the absolute first thing that happens is something called endothelial dysfunction. The endothelium is just the super delicate one-cell thick lining of our arteries. When that lining gets damaged, it's like opening the door and inviting trouble in.
And this is so crucial. We've spent decades blaming cholesterol as the big villain. But it's not. The problem starts when the artery wall itself, that endothelium, gets damaged. That damage is what allows cholesterol to get out of the bloodstream and into the wall, where it starts causing all the problems. So protecting that lining, that's everything.
So how do we protect that precious lining? The answer is right here. It's not some magic pill or a complicated surgery. It's the 6 pillars of lifestyle medicine. It's a whole-body, holistic approach to how we live.
So what are they? First, what we eat. Healthy foods protect that lining. Second, exercise. Moving our bodies improves blood flow. Third, our sleep. That's when our body's repair crew gets to work on that lining. Fourth, managing our stress, because stress hormones are like poison to the endothelium. Fifth, avoiding risky stuff like tobacco. And finally, believe it or not, our relationships. Strong social connections actually lower the inflammation that causes damage. Each one of these is a powerful tool you can use.
And that brings us right back to where we started. This isn't just a story about getting old. It's a story that starts when we're young, and it's written day by day by the choices we make. So the question for every single one of us is this: what story are you telling with your health?